Diabetes is a chronic health condition that affects how your body turns food into energy. The body either doesn't make enough insulin or can't use the insulin it makes as well as it should. This leads to too much blood sugar staying in the bloodstream, causing serious health problems. The three main types of diabetes are type 1, type 2, and gestational diabetes. Type 1 is often diagnosed in childhood and requires daily insulin. Type 2 is the most prevalent form globally, often linked to lifestyle factors. Gestational diabetes occurs during pregnancy and increases future risk for mother and child. Understanding these types is crucial, especially in regions like Africa. Diabetes is rising at an alarming rate in Africa. In 2021, there were 24 million adults with diabetes in the IDF African region. This number is expected to reach 55 million by 2045. Urbanization, diet changes, and lifestyle modifications are key factors. Many are unaware of diabetes signs, leading to late diagnosis. Public health campaigns are essential for awareness and early detection. One of the critical issues in managing diabetes in Africa is the high rate of undiagnosed cases. An estimated 54% of individuals with diabetes in the region are unaware of their condition. This lack of diagnosis is partly due to insufficient healthcare infrastructure and limited access to medical facilities, particularly in rural areas. Late diagnosis often leads to severe complications by the time diabetes is detected. These include cardiovascular disease, nerve damage, kidney failure, and visual impairment. The burden of these complications is not only a personal health issue, but also a significant public health challenge, placing additional strain on already overburdened healthcare systems. Compounding the issue of late diagnosis is the scarcity of reliable data on diabetes prevalence and complications in Africa. Many countries lack comprehensive diabetes registries, making it difficult to assess the true scope of the problem. This data scarcity hampers efforts to plan and implement effective public health interventions tailored to the region's needs. Improving diagnostic capabilities and increasing access to healthcare services are critical steps in reducing the rate of undiagnosed diabetes. Mobile health clinics, community health worker programs, and partnerships with local organizations can help bridge the gap, providing essential services and education to underserved communities. Several factors contribute to the rising rates of diabetes in African countries. Obesity, often driven by changes in diet and physical activity, is a significant risk factor. The increasing consumption of processed foods and sugary beverages, coupled with a decrease in physical activity, has led to higher obesity rates, which in turn elevate diabetes risk. Access to healthcare is another critical factor. Many African countries have limited healthcare resources, making it challenging for individuals to receive timely diagnoses and treatment. The availability of essential medications, such as insulin, is often restricted, and many rural areas lack adequate healthcare facilities and trained personnel. The economic burden of diabetes is also considerable. The cost of managing diabetes can be prohibitive for many individuals, leading to poor disease management and increased risk of complications. In addition, the healthcare systems in many African countries are already strained by communicable diseases, leaving fewer resources available for chronic conditions like diabetes. Efforts to reduce diabetes rates must address these underlying factors. Public health policies that promote healthy lifestyles, improve access to healthcare, and reduce the economic burden of diabetes are crucial for reversing current trends. Additionally, increased investment in healthcare infrastructure and workforce development can enhance the region's capacity to manage and prevent diabetes effectively. Section 5. Urban versus rural prevalence of diabetes. Diabetes prevalence in Africa shows a notable disparity between urban and rural areas. Urban areas have higher rates due to lifestyle changes. These include decreased physical activity and increased high-calorie food consumption. In rural areas, prevalence is lower but access to healthcare is limited. Residents may lack awareness of diabetes symptoms. The urban-rural divide reflects differences in healthcare infrastructure. Addressing this disparity requires tailored approaches for each setting. Section 6. Diabetes Care Cascade. The diabetes care cascade in Africa highlights significant gaps in diagnosis, treatment, and management. Of those with diabetes, only 54% are aware of their condition. Among those diagnosed, 73% receive treatment, but only 38% achieve adequate blood sugar control. This cascade emphasizes the urgent need for improvements at every stage of diabetes care. Diagnosis is the first critical step in the care cascade. Increasing awareness and access to screening can help identify more cases of diabetes early. Community health campaigns and partnerships with local organizations can raise awareness and encourage individuals to seek testing, especially in underserved areas. Once diagnosed, access to treatment is essential. However, many individuals face barriers such as high medication costs and limited availability of insulin. Ensuring the availability of affordable medications and expanding healthcare coverage can improve treatment access and adherence, reducing the risk of complications. Finally, achieving blood sugar control requires ongoing management and education. Patients need support to make lifestyle changes and adhere to treatment regimens. Healthcare providers can play a crucial role in educating patients and providing resources to help them manage their condition effectively, ultimately improving outcomes across the diabetes care cascade. Section 7. Socioeconomic impact of diabetes in Africa. The socioeconomic impact of diabetes in Africa is profound, affecting individuals, families, and healthcare systems. Diabetes-related healthcare costs in Africa were estimated at $13 billion in 2021, representing a significant burden on national economies. These costs include direct medical expenses, such as hospital visits and medications, as well as indirect costs like lost productivity and income. For individuals, the financial burden of managing diabetes can be overwhelming. Many people struggle to afford necessary medications and healthcare services, leading to poor disease control and increased risk of complications. This economic strain is particularly acute for low-income families, who may face difficult choices between healthcare and other essential needs. The broader impact on healthcare systems is also significant. Diabetes management requires ongoing care and resources, which can strain already limited healthcare budgets. As the prevalence of diabetes continues to rise, the demand for healthcare services will increase, exacerbating existing resource constraints and potentially affecting the quality of care for other health conditions. Addressing the socioeconomic impact of diabetes requires a holistic approach that includes expanding access to affordable healthcare, reducing medication costs, and implementing policies that support individuals with diabetes. By alleviating the financial burden of diabetes, African countries can improve health outcomes and strengthen their healthcare systems. Section 8. Potential strategies for improvement. Several strategies can be implemented to improve diabetes management and outcomes in Africa. Public health education campaigns are vital to raise awareness about diabetes and its risk factors. These campaigns can emphasize the importance of a healthy diet, regular physical activity, and regular health checkups to detect diabetes early. Improving access to healthcare is another critical strategy. Expanding healthcare infrastructure, particularly in rural areas, can increase the availability of diabetes screening and treatment services. Mobile health units and telemedicine can also enhance access to care, especially in remote and underserved regions. Policy changes can support these efforts by reducing the cost of diabetes medications and increasing healthcare funding. Governments can work with international organizations and pharmaceutical companies to lower medication prices and ensure a consistent supply of essential drugs like insulin at affordable prices. Investment in healthcare workforce development is also essential. Training healthcare professionals in diabetes management can improve patient care and outcomes. By implementing these strategies, African countries can address the growing diabetes epidemic, enhancing health outcomes, and reducing the disease's socioeconomic impact. Section 9. Conclusion. Diabetes presents a significant and growing challenge in Africa, with its prevalence set to rise sharply in the coming decades. The high rate of undiagnosed cases, late diagnosis, and complications underscore the urgent need for improved healthcare access and education. Addressing the underlying factors contributing to diabetes, such as obesity, urbanization, and limited healthcare resources, is critical. Efforts to combat diabetes must consider the unique challenges faced by African countries, including economic constraints and the urban-rural divide in healthcare access. By focusing on public health education, improving access to affordable healthcare, and investing in healthcare infrastructure, African countries can better manage the diabetes epidemic. The socioeconomic impact of diabetes is significant, affecting individuals, families, and national economies. Implementing effective strategies to reduce this burden will require coordinated efforts from governments, healthcare providers, and international organizations. With the right interventions, Africa can mitigate the impact of diabetes and improve health outcomes for millions of individuals. As the lecture series begins, these foundational insights into diabetes in the African context will set the stage for more in-depth exploration of strategies, innovations, and collaborations needed to tackle this pressing health challenge. By understanding the landscape of diabetes in Africa, stakeholders can work towards a healthier future for the continent.